I'm here in Greenville now with Dr. Cedrek McFadden, and we're going to talk about some of the questions that you've been placing on the 7 News Facebook page as we keep you up to date on the coronavirus, the medical side of things. So, Dr. C, thanks for joining us again. Joel is asking, what, in your opinion, is your opinion of what the CDC just said today, that the virus does not transmit through surfaces as easily as first thought? He thinks they're backpedaling a bit.
I mean, it's the reality of living in real time. I mean, as you get more information, you have to adjust the language of the message. They actually initially said that it may be possible to be spread in other ways, and now the language today is slightly different. It just says the virus does not spread easily in this way. And so it's just a slight twist of the words. The World Health Organization statement hasn't changed at all, but this is specifically from the CDC. They've changed language just a bit, likely to reflect the fact that, again, this is still a respiratory virus. It primarily spreads through
the droplets.
Correct. However, there is some still speculation that it could be, but again, not as easily as through the respiratory droplets.
And we don't need to change anything as a result of those
Keep washing
three words
your hands,
changing.
exactly, doing the exact same thing.
Candace is saying, hello, wondering how they are going to control the virus in the community pools as they open them up around the region.
A lot of conversation as we get closer to summer around that. It becomes the issue of social distancing, even outside of the pool, whether it be just on the deck or keeping the pool itself with proper chlorine levels and making sure people are still doing those sorts of regulatory items to make sure the pool is in tip-top shape. But the big issue is making sure what happens outside of the water should still be socially distancing, should still make sure you're not sharing, toys or things like that you may be using at the pool.
And that's hard to do with the kids, right? To keep
Absolutely.
them away from that stuff.
Which is why we probably will see less people being able to be using those facilities for a little bit of time.
So they'll limit how many can
Most
go.
likely.
Gotcha. All right, Lisa is saying how to get the antibodies test done and what is the ballpark cost of it?
So you can ask your healthcare provider. You can also find sites on the website that you can directly get these tests ordered. We were talking earlier during the break that the Blood Connection has a promotion where if you're donating blood, they'll also be testing for these antibodies. It takes about 7 days to get the results from that. And then if you do have those antibodies present, you may be able to be helpful in other ways by donating plasma to people who may need it, who are actively going through a COVID infection. So a little bit of win-win for both parties there.
And the cost, roughly?
The cost can be dependent on your own insurance coverage. For Quest, it could be up to $119, plus there's some service fees allowed with that. But you want to talk to your own insurance providers about what those costs may be for your particular coverage.
Well, we appreciate you always being here. You're coming back on Thursday to answer more questions. So if you have any more questions, add them to the Facebook page, and we'll see Dr. McFadden on that date. Thank you so much, sir.